Tell me what's wrong with
It's only
your
when
knee.
I do kneeling poses.
Yeah.
I can't put too much weight on it.
So what do you mean? When you kneel down on the
Yeah,
floor?
yeah.
So which area, let's look at, which knee would you like to look at first?
Left knee.
Left
This one
knee.
is not bad.
Not
I
too
can
bad,
put weight.
but that's you tolerating with pain. So it eventually becomes bad, do you see what I mean?
Yeah.
'Cause, yeah. So,
And that's why I put support, thinking not to make it worse.
I'm like, wow, I mean, the list is endless, literally, and I'll do my best.
I can't see any swelling.
No, it looks, actually from here it looks good, but until I get a sense of it, I don't know. So where's the pain on the left leg?
There's no pain as I'm walking. It's only when I kneel on it.
Okay, but where is it when you kneel on
It's
it?
somewhere in the centre
Okay,
point.
and where's the
somewhere
pain
there.
of the right knee?
There's no kneeling pain
So
there.
why do you have the support for that knee as well?
Yeah, because I could hear some clicking and things.
Oh, clicking. So do you want
Yeah.
to just quickly check those knees?
Yeah, yeah.
And then we'll go back to the right
Okay.
sciatica and the left
All
side.
right, yeah, we'll do that.
Yeah, happy to oblige. So let's
So,
see.
would you...
It's fine. Okay.
Are you okay kneeling?
Yeah, I'm okay. Yeah,
that's not what I could do.
That's a nice shot. Yeah,
Yeah.
that's nice. Okay, let's. You can't do this.
No.
Can't put pressure on them.
Yeah.
Oh, no. Okay. So let's have a look at this. Where's the pain? It looks. Your knee looks in good. Your leg looks in good nick, brother.
Yeah, it's,
Yeah.
it's somewhere when central, and then I have to sort of
You manoeuvre it, do you?
yeah, and I have to maneuver it to avoid that. So I'm not quite sure unless I kneel.
Oh, did you feel that? Oh, well, you didn't feel that. I did.
No, but there are
It's
sort of
a-
clicks and
Yeah, yeah. I think you just disconnected from your body. You just plough through. Yeah, you just plough through regardless, don't you?
yeah.
You go, I don't care if the body's suffering, I'm just going to do it anyway.
I'm gonna keep moving, even my body's restricting
Wow.
me.
Oh my goodness.
It felt like click.
I mean, you can see the benefits that you gain from the yoga and Pilates, but there's a sort of like wall that
It's
prevents
preventing
you
me to,
reaching a higher level
Yeah.
of physical
Yeah.
agility.
yeah.
Does that make
That-
sense?
That makes sense, yeah.
So it's a frustration, really,
Yeah.
of wanting to go
And
higher and better, become better at what you do, but your body isn't allowing you to.
yeah, it's restricting.
Did you feel that?
I can feel it, like when you
You just
press
went. Yeah, but it's in good nick. This, the peripheral part of your body, because of what you've been doing, you've kept in good nick actually. Yeah,
So there was another click there, like sometimes I get those clicks.
yeah.
And down.
Well, if not treated, they can actually, years down the line,
Yeah.
cause arthritis.
I probably have arthritis.
Is that what's coming through?
Well, a few years ago, my finger was swelling. So I went to the doctor and we x-rayed it and there was no fracture or anything. So he referred me to rheumatologist.
Yeah.
And they said, I've got rheumatoid arthritis.
Gosh.
And they wanted to put me onto medication, which I refused.
Yeah. Yeah.
I've changed my diet and there's no more swelling. And after 2 years visiting the hospital rheumatologist, he discharged me. He goes, you made the right choice, he said to me.
Yeah, I mean, medicines, I think, are helpful if it's a very serious condition.
I know. It was only a swelling on one finger and they wanted me to go on medication already. And
but a lot of conditions can be turned around
yeah.
if you change your daily lifestyle.
Yeah.
This is nice.
And
Don't be nervous.
no.
It's nice.
Oh yeah, they were scaring me. They said
So
if I don't
nice.
take the medication, my fingers will all go wonky and
Don't worry. No, I mean, I love what you're doing because you're doing everything you can to try and stem any level of deterioration. Yeah. Do you feel? Oh, do you feel that?
Mm.
See how that feels now.
And I think the knee.
I haven't worked on that bit. I've just worked around.
It's like that because of the tight hamstrings.
I mean, everything in your body is interconnected, so each problem leads to a second problem and a third problem.
But I mean,
I've worked around the knee.
Yeah.
I think that's nice. So I'll just go to the part that you said that was painful. Which part was painful? It does look
there.
Yeah.
I don't know whether it's the.
You're not sure of the area?
No, I'm not unless I kneel. Then
I wouldn't want you to do that.
It's somewhere there underneath, not
Sure.
that bony bit, just underneath there.
Okay, sure. Okay, so I think this. So what I want you to do is go in that direction. Because what I want to do is bend it and see. Yeah, that's nice. That's great. Yeah. Just see what we're up against. Does that feel okay?
Yeah.
Don't let me guide you. Don't worry.
Yeah. Okay. I'll be floppy.
Yeah. Don't take over.
Yeah.
Yeah. So it's when it goes this position.
Yeah.
That's when you will. Yeah. It was. Yeah. That's nice. So actually, it's not this movement. It's this one.
Yeah.
When it locks in and you go put all the weight down.
Weight on there. Yeah.
You've got it. Is that painful?
It's not. I mean, I can feel it round there a little bit, but it's not pain.
Yeah,
it's
but
just.
you can feel it.
Yeah.
So you're starting to connect with your body more. Yeah.
As I said.
There is a resistance when I do that.
And the pain is only when I kneel.
Yeah. So it's that movement. By
Yeah.
the way. You see when I finish that movement?
Yeah.
That's where the pain arises.
Yeah.
So it's that movement.
Yeah.
Yeah. Yeah. It's sort of locked in that position. Oh wow. Can you feel it? You can't feel it. Yeah, there's a slight strain when I do that.
I mean, I can feel the kicking and all that when you feel that. But I thought that's all normal.
That's what's causing the problems.
I've had the clicks for a long time, so I thought it was just part of it.
Got used to it.
Yeah. When you press it there,
How's that feel?
you feel the pain. Yeah. I wouldn't say it was much. Yeah, it's just like tolerable pain.
Does it go all the way up to your thigh?
No, just the knee.
Just in that
Just there. Yeah.
Yeah, I can feel that.
Yeah.
Yeah?
Yeah.
Can you feel that? Oh, wow. Yeah, feel that.
Oh, yeah, that's it. Ow, yeah, that's it.
Yeah. It's actually going all the way down the leg. Yeah.
And this is what I meant when you go for massages.
You're
when
not
they,
able to rotate this knee much. It's just when you go for massages.
when they press like that, it goes all the way down.
Yeah. Is it doing so today?
Not right to the toe, but yeah.
Because this part is quite stiff.
Yeah.
But you're giving me the control, so I think you would be much more rigid.
Okay.
Because you've experienced my work, so you're more relaxed.
Yeah, I've got faith in you.
Yeah, you've got more relaxed, which is good. Do you see how resistant you are? Why the resistance? Is it because you're not used to giving up control? Do you think?
Could be.
Yeah.
Could be.
Remember my first words to you was about learning to trust.
Mm.
Because you do everything yourself.
Yeah.
Oh, can you feel that? I can feel that.
Yeah. It could be that it's a very long time before I even let anybody massage me.
Oh, what do you mean by that?
Like
to actually
touch you. Touch me and massage me.
No, but I got that when you were
Yeah.
saying you've got a business card. You put all these barriers in front, and I just said,
Yeah, that's where
You make the
that's where
decision.
you're pressing. That's where it.
yeah,
Yeah. That's it.
go relax. Yeah,
Yeah.
yeah, there,
That's it.
yeah. Point the toes. Relax. Yeah. Does it hurt? Is it when I stretch it?
It's not hurting when you're stretching like that. I can, where your thumb is, I can feel the pain there.
Straighten the back. Yeah.
There could be an old injury.
Well, I think everything I'm doing with you is an old injury.
Just a few years ago I fell and my leg slipped.
Did you? And when
And
it's
twist
funny
like that.
direction.
Yeah, and it was swollen for a while, but luckily no breaks.
Mm. It's all coming back then.
Yeah, so it could be to do with that.
Yeah, it will be. That's nice. Oh, did you hear that? Oh, it's right at the back there. Yeah. Wow, you've got so many bits and pieces that you
I'm
put
falling
up with.
apart.
It's amazing how you soldier on. Yeah, do you feel that?
Yeah, I don't want to fall apart.
I'm staggered you're able to do all that you're able to do with all the things that you're having to tolerate. Yeah, that's nice. Oh, do you feel that? Yeah.
Yeah,
There.
yeah.
Yeah. I'm really happy with that.
Yeah.
Right. So, you just check this part. So, yeah, this is solid. So it's literally just the actual knee and behind and then just check it. Straighten the leg. Where's the pain?
Just under your thumb, that's it.
This part?
Yeah.
Is it when I go forward? Or when
No.
I go back? There.
There,
Felt it?
there.
Forward?
No,
Got to work with me. And then work back.
there, there.
There. So it's actually this movement?
Yeah.
This movement. Because you've not done it?
Probably.
Yeah, this is very painful.
That's, yeah.
Yeah.
It's only when you press it, and I thought,
Yeah, straight.
that's just all normal, part of, like, everybody feels it.
Well, everybody's body is different.
Yeah.
It's the
Because
pain
when I
right
try
here.
to explain
Yeah.
to the people that's giving you massage, it feels really painful when you do that. Is that normal? And they said, maybe I'm a bit more tender than most people.
No, I can feel there's been some sort of trauma there. I mean, their way of doing things is nobody does things the way
Yeah.
they do, so they might not even be
Yeah.
aware of the difference. But I think, yeah, there.
Yeah. Oh, yeah. when you're pressing all that,
It's releasing.
it's painful to me.
But
You
is
know,
it getting better?
Yeah, but I'm thinking, is that normal for everybody? Like when you do
Everyone's
massage?
different. See,
Yeah.
the pain that you're suffering from
Yeah.
with your knees and your shoulder and the sciatic pains
Yeah.
from both sides of the body, that's your history.
Yeah.
So all that is unique to you, no one else.
Oh, right. Okay.
And your body soaks it up in a straight way. You have real control issues. You just don't like to let go of control. Did you hear that?
Yeah.
Great. Yeah. And you've got to learn to. Control's not a bad thing, but it's
Yeah.
when you take it to the extreme
Yeah.
that your body actually just gets overwhelmed. I like that. I think that's nice. See how it feels now.
Yeah. I mean, there's no less clicks now. If I was doing that earlier,
You wouldn't
like
have that
here,
mobility.
you can hear.
I mean, what
the
I loved
click.
is you did a rotation, so you're confident.
Yeah. So I think.
Are you happy with that?
Yeah.
Okay,
See
so
how
now
it goes.
walk on it and see how it feels. Yeah, just walk on it.
Yeah. That leg feels fine now.
You're happy with
Yeah.
that? So,
But I'm getting a bit of
yeah, because I
issue
haven't
there.
done, I haven't
Yeah,
done
because
sciatica.
of maybe the way I was lying here. And
Yeah, for a
yeah.
length of time.
Yeah. But otherwise, this
You're happy with that?
Yeah.
Okay.
Yeah.
I'll quickly move on to the right leg because that
Okay.
was minor, and then
Yeah.
I'll go to the sciatica.
Okay.
So it's the other position, is it? Oh, it's the same.
Same.
How are we doing it?
No,
Where-
this knee's. I
Are
don't
you
think-
okay with your knee? Okay.
If you press it there at the same place, then I know that it doesn't hurt as much as.
Do you want me to test
Yeah.
it out?
Yes, please.
Sure, okay.
So that will show me that was
Then you can compare it.
compare
can't
it
you?
that was pain
Okay. Let me just
due
go
to the
across.
trauma.
Yeah, but you're happy, okay.
Yeah.
Because I don't like to move on until you're absolutely
Yeah.
sorted.
No,
So we're now looking at the right knee, aren't we?
Yeah, it feels.
You're okay with that.
Yeah.
Now I love how you rotated. It shows that your confidence in the knee has gone up manyfold.
Mm.
So,
Do you want me
so you
to-
said this was minor.
This
but
is just minor
but what
clicks and
do you-
things I hear, so I thought
clips. Okay,
maybe
sure.
when I'm doing exercises, maybe a support might help. I don't know whether that's the right.
Well, it's always
thing.
support's always a temporary thing, but it means there's a problem that's not being addressed.
Right.
So I always think it needs to be addressed. I want to zoom in a bit more. Okay, let's see. Yeah, this is much better.
Mm.
Yeah, you can't compare really. Can't compare the previous
That-
one.
yeah, that
yeah,
was-
it's like poles apart. This is lovely. Yeah, I'm not off camera. Wait a minute. I'll go out a bit. Yeah, no, this is chalk and cheese.
Yeah, okay.
It's nice. Yeah, this is much better. Do you feel that down here? It's sort of. Yeah, it's just on the right hand side actually,
Mm.
but it's nothing major.
Nothing like.
No,
Are you putting
it's
the
nice.
same amount of pressure as you were on this when you were pressing here?
No,
Oh, right.
every condition's different.
Yeah.
You know when you ask Petra like, does that hurt and blah blah
Yeah.
blah. I mean, each injury I approach it in a specific way,
Mm.
and it depends just on your body and
Right.
the extent of the injury.
Mm.
So I've gone straight in with this knee, but I didn't do the same with that
Yeah.
one. I was much more.
Yeah. And I'm trying to be as floppy as possible, like
No,
giving
no.
no full
You're doing
control to you.
superbly
but-
well, but I feel more confident with this knee
Yeah.
to go straight in and
Mm.
get to the bottom of it,
Yeah.
whereas I had to go more
Yeah.
slowly, more gently with it. But I think most of the problems you're having was the up and down here actually.
Mm. And I thought it might all be
And
to
up
do
here.
with the
Well, that's the extraordinary thing about the body, mind and body, is that whatever isn't being addressed comes through as an illness of some shape or form. So it was the top that also needs working. But yeah, I like it. I think it's a good knee. It's in good nick. Let me just check the back. Yeah. Yeah, the back is quite stiff actually, around the back here.
That's just the tightness.
Very tight. Hugely tight.
Very tight.
Wow. Yeah. Very tight. Yeah. It's alright. This is here.
That's very tight.
Yeah. Do you do any running or
No.
on a treadmill?
No.
This is what's pulling, by the way.
No, I don't.
This whole
do
area
running.
is
Yeah.
pulling.
I
Can you
don't
feel
do
that?
running. Yeah.
So point your toes. Yeah, this area is pulling. That's what's causing, all the pain. And I think it's because you don't do much manoeuvrability with the knee. You keep it in a sort of fixed position.
That's what I was saying. When I'm in the kitchen,
There's
it's
no-
just downward. It's no
Yeah, there's no,
sideways
you don't sort of do any
rotation.
rotational movements, yeah.
Yeah.
It's in one fixed position, so it gets overused. Yeah. But the actual knee, I'm happy with. It's actually
The tightness.
behind here,
Yeah.
so I won't touch that until
Yeah.
I've worked on your sciatica.
Yeah. Okay.
And but yeah, I'm happy with that knee.
Okay.
But I do think the pulling of the hamstrings relate to
To
the
this. Yeah.
sciatica.
Yeah.
So let's move on to the. We were doing the right sciatica yesterday,
Yeah.
weren't we?
Yeah.
And I hadn't quite finished it. had I?
Okay.
So let's move on.
Okay. Jill, you want to lie down?
Yeah, I think when you were flat, weren't you? And you had your shoulder, no, the shoulders were on the floor, absolutely. So I want you totally flat. And then let's pick up from where we left off yesterday.
Okay.
Are you happy with that?
Yeah.
Okay. Which was the knee I just worked on? Was it this one?
Left was the
Left.
word.
Which was the worst one?
The left one.
So this was the good one?
Yeah.
So this was the area that,
Yeah.
yeah, I will get to it. But this is the area I need to work
Yeah.
on, basically. Because this is where it was all so tight down here, by the way.
Yeah.
Here, do you feel that? Oh my gosh. Here,
Yeah, that's all.
Can you feel that?
Yeah, that's very.
all there. Oh my lord. Yeah, so it's that movement there that's pulling. It's like a very, very tight
Yeah.
elastic band that is desperate to ping. Yeah, and it's going, oh, and it can't ping. Do you see you resisted against that?
Yeah.
That's why, yeah. So I'm going to go very gently with
Yeah.
it, actually. I'm going to start on this, so you said you still felt pain there, but not
Yeah,
so much.
not as much.
So where is the pain at the moment?
It was sort of down there.
And where is it painful?
Here.
At the moment? Yeah, it's there, okay.
Yeah. Only when I touch it.
Yeah, so really it's operating at a deeper level.
Yeah.
There,
Yeah. That's where we were feeling yesterday. Yeah.
yeah. And does it go all the way down? Where does it go? That pain?
That pain. Sometimes I feel it going down, but
Or does it
it's
jump or does it go straight?
not, no, straight down. Like
Show me the line from here.
it goes sort of like that.
Right. Okay, got it. Is this here? Is
Yeah.
Then,
But more. Yeah. I mean,
no, I'm
it's
not
quite
going.
a big area around there.
Yeah. I'm just going to
Yeah,
go
that's it.
deeper.
That's it.
It's not on the surface. It's quite deep. Your injuries. Then.
That.
So I can be more. Is that painful?
Yeah, you carry on, that's fine, I'll tolerate it. If it needs releasing.
Mm. There, I can feel it.
Yeah.
I can be more robust actually today. I couldn't do this yesterday. There. There?
There is, yeah, it's a bit less, more right. Bit up, that's it, there.
There?
Yeah.
I can feel your body react against it. Because it's not been worked on. There. It's there actually.
Yeah.
There.
That's it, yeah.
That's the area.
Yeah.
Yeah. It's improved a lot since yesterday.
Yeah.
It really has. But actually, this area that I'm working on,
That's fine.
I didn't work on it
And
yesterday.
that seems okay.
Yeah. So it's
just
going
there,
to the right.
yes. Going to the right.
Sure.
That's it.
There.
There, yeah. So it's not disc related.
No, I didn't get a sense. I wouldn't interfere with your discs,
Yeah.
but nothing so far has been disc related.
Yeah, that's it. It's quite a big round circle there, isn't it? Yeah. And I can feel that right away, right to my toe.
Can you?
Yeah.
Oh, wow. There.
Yeah.
That's like a solid mass there.
I feel that going down my
So
spine. That is going,
there.
radiating down.
Yeah, so this
Yeah.
is what's caused a lot of problems. This part. There.
A bit more to the right.
Can you
Yeah,
feel
that's
that?
it, that.
Yeah. Can you feel it?
Yeah, I can feel that. Yeah.
This whole area is one solid mass, by the way. Amazing.
And how can I?
You can't do anything. It's very difficult to reach. And it's deep. It's very deep.
Yeah.
Wow. There. There.
Yeah.
There.
That's it.
Wow. You. I don't know how you manage with all these issues. Oh my god.
I thought everybody has them.
No, you're a glutton for punishment, that's all I can say. You just store them up one after the other. They just don't get resolved. Wow. They just don't work, they don't get resolved.
Oh, yeah.
I can feel it go all the way down
Yeah.
your leg. Oh, I can feel that. It went through your knee as well. Amazing. Wow. I'm still not hitting your vertebral column, I'm just beside it. By the way. I'm not touching your
Yeah.
vertebral column. I'm
Yeah.
just next door to it. It's
It's just there, that's
amazing.
it. That's it.
There.
Oh.
Wow. There. Yeah. There.
Yeah. And that causes the tightness of the hamstring and...
Well, this is a one solid mass. Wow. I mean, this is years in the making. Wow.
And it can't be arthritis issue or anything, could it?
No. It's just tough tissue. But I'm being very gentle.
It doesn't feel like it.
Well, I'm not going down, I'm
Yeah.
going across. If I was being very hard, I'd go down. But
Oh,
I'm
right,
not, But
okay.
I'm not. I'm actually going across.
Yeah.
I'm just slowly working through it.
Yeah.
But it is quite tough though.
And I've had, like I said, acupuncture and things, and it hasn't
Touch.
helped.
It's quite thick. This whole area.
Yeah.
It's quite thick.
Yeah, that's it.
It's like corrugated iron. It's really steel. Like, wow. There.
Yeah, it's not as bad there. It's like,
Okay, show me where the
maybe
pain
you
is.
released it now.
Show me where the pain is now.
Maybe you have managed to. I think there is more.
One finger, show me where it is. Okay, because I didn't work. There?
There, where my thumb is.
Where your thumb is. Okay, sure.
A bit lower down. That's it.
There?
Yeah.
I haven't touched that area. You always point out the area I have to go to. Right?
Because you've sorted out the rest of it, so
Oh, well
maybe
done.
that's.
No, good team effort. I was thinking, but I haven't done that area. That's why it's still in pain.
Yeah.
Yeah.
But I feel it's not a small area, it's
It's quite a large
quite
area.
a large area.
Yeah, agreed. But at least you're getting to know your body again, which is good. You were very disconnected yesterday. There. You said it goes all the way down?
Yeah.
Down, show me.
That's when you're feeling it down. And then radiates. Sometimes it radiates down, sometimes it's fine.
Show me. Show me the line.
Sort of from there, radiates
Oh.
down.
Down there.
Yeah.
So how's the pain feel at the moment here?
If I'm just standing and things, I don't feel it. It's not like a nagging
So
pain
when do you
anymore.
feel the pain?
But it's only when you press it now.
Does it feel painful?
Yeah, a little bit.
Which part?
It's mostly this part there.
This part?
Yeah.
Okay.
I think that's it. That's the spot.
That bit.
Yeah.
I mean, you've got so many different things that were painful. Oh my God. It wasn't just one thing. This is going this way. Oh my Lord. Wow, this is completely different.
Is it?
Yeah, it's going that way.
Oh, it feels like when
It's
you
a
press
completely different muscle group. But yeah, it's nice. It's not too bad. It's one of the nicest ones so far. It's quite on the surface, and it actually is not rock hard. It's very nice actually. It's easily doable. But all the muscles I've worked on yesterday and today have been very deep.
Yeah.
This is the first shallow one actually. Yeah, it's not too bad. This is quite easy, this one. But it's very different. Wow, okay. Yeah, I'm happy with that. And show me the pain again. That's like, is it painful?
No, it's not as bad as it was before. Like over there.
Yeah, I haven't worked that
Yeah,
part.
that
Okay.
part is.
Oh, interesting. There,
Yeah. Yeah, that's
Yeah.
it.
I haven't
Oh,
worked
yeah.
on.
Oh,
There.
yeah, that is painful.
Yeah, you feel it there.
Yeah.
Yeah, that's another deep muscle pain.
Yeah.
So literally all the problems you've had is because it's very, I think 98% deep muscle,
Yeah.
and it just hasn't been reached by them.
Yeah.
But it's
And
not.
that is a different, like you said,
Yeah, it's very deep.
different muscle because
Yeah.
that I can feel it radiating up now.
Yeah. This is very deep,
Yeah.
but it hasn't been worked on. What were you going to say?
I said that bit when you were pressing,
That's very
it was radiating up
all the way up.
here,
Yeah.
whereas before the other
It's
bit was
radiating
radiating
down. No,
down.
they're two different
Yeah.
muscle groups.
Yeah.
Yeah. This was one.
Mm.
This is another.
Yeah,
Yeah. Is it still going up?
a little bit, yeah.
How far?
Just up to there. That's it.
Because this was quite fragile yesterday.
Right.
But I felt I could be more bolder today.
That's, yeah, that's it.
There.
Yeah. That again is it.
There.
Yeah.
Yeah, I could feel it. There. I'm being very gentle.
Are you?
Yeah, I am. I'm not going deep.
Okay.
I'm being very just surface level.
Okay.
There.
Yeah.
There.
Yeah. That's it. Okay.
Because this was very weak yesterday.
Yeah.
Yeah, here.
Yeah.
Yeah. I think this has been the root of the problem here.
Mm.
This whole area
Yeah.
has been the major reason why you've had all the problems you've had in the lower part of your body.
Mm.
This part,
Yeah.
by the way.
Yeah, that's it where you're actually pressing.
Yeah, there. Is it right if I put my hand underneath?
Yeah, that's
So
fine.
open? Just so that I can get to the root.
Yeah.
Show me where the pain is again with your finger. Because I think this is key if I get to the bottom of it. How are we doing for time? Are we still okay?
Let's just check. Let me check myself.
Because I don't want to get locked in. How are we doing? Is it gone 10 o'clock?
Just getting my clock back. Yeah, it's on 10 o'clock.
Oh, we've got to go, or else we'll get locked in.